right. I can see we have numbers in. So we'll start off the session. Thank you all for joining us today, and good afternoon from wherever you're joining us from. My name is Jimmy Brian Awange from One Health. I am the insurance network executive here, and I'd like to give a brief introduction of who we are before introducing the speaker. So we are a global medical facilitation company based in Kenya and the UAE. And our role and our main core business is to provide access to healthcare for patients globally. Our mission is to connect people and organizations across Africa to world-class healthcare. And so far, we've been able to facilitate over 50,000 patients globally to access healthcare. Today, we are here as your valued partners to provide knowledge into you and to update you on what's happening around neurorehabilitation inside NeuroGen Brain and Spine Institute in India. So we'll have a very interactive session. I beg all of you to participate. We'll be sending polls throughout the session. Please interact with those polls to inform us on how impactful and relevant the session has been. We'll have testimonials from NeuroGen and Brain and Spine Institute, and also we'll have a session at the end for Q&A. With that, I'd like to introduce our speaker of the day, that is Dr. Nandini Gokul Chandran. She's the Deputy Director and Head of Medical Services, Consultant of Regenerative Medicine at NeuroGen Brain and Spine Institute in Navi, Mumbai, India. She's here, packed full of knowledge, ready to impart that knowledge onto us and to address our major concerns. I know currently in Africa and the spaces we are in, we've seen an increased trend in a lot of neurodivergent issues and also neuro cases from stroke as the main cause to also iatrogenic issues that bring about diseases that are affecting both our brain and spine. With that being said, I'd like to hand it over to Dr. Nandini Gokul Chandran to take us through her presentation and tell us a bit more about herself. Yeah, 3 things about you, Daktari. Your hobbies, your likes, your dislikes, so that we get to know you before we get into the
Sure.
content.
Thank you. Thank you
All
so
right,
much, Jimmy, for this introduction. And first of all, I would like to acknowledge and thank My Health for this opportunity to get in touch with people around different walks of life, including those who have patients of incurable neurological conditions in their home. And I'm hoping even those who are service providers, caretakers, stakeholders, all kind of stakeholders for children and individuals with neurological conditions. So I'm Dr. Nandini Gokul Chandran, and I'm the head deputy director and head of medical services at NeuroGen Brain and Spine Institute, and my focus is on regenerative medicine. I am basically a medical graduate and postgraduate from a small place in Maharashtra, that is one of the states in India. Mumbai is the capital, and Nagpur, where I studied, is the second capital of this state. I did my MBBS and MD in medical microbiology, followed by 4 years of research stint on developmental neurobiology. And so that's my area of interest. I love to read. I love meeting people. I love going to different parts of the world, and my work takes me to all different parts. I've had the immense honor and opportunity to go to different parts of Africa, including Kenya. I've been to Nairobi, to Mombasa, to Uganda, to Cameroon, to Cote d'Ivoire, to Tanzania, to maybe Mauritius. So I've been to a whole lot of places in Africa, and I've fallen in love with all of you people. So we have lots and lots of patients coming from all over Africa and have some beautiful success stories, some of which I will be presenting, and some of which the family, we call all our patients our family. We hope when they come here, they feel like one. They have a family in Africa and they have a family in India. So that's how we treat our patients. And two of our family members are here and who will share their experience with you. But I have a lot to talk to you, and I will try and do justice as simple as possible, but as lucid as possible. But also, I have to caution you that the amount of work that we have done in the last 16 years, it's difficult to compress it in an hour. I will try to do it as much as possible, but there may be a large bits which still remain there, and maybe Jimmy will have to call me again for another presentation. So, with that introduction, if I have the permission to start, Jimmy. Anu, screen
Yes.
may be-
We are going to run a quick poll with the audience in the chat. Then Dr. Amy can just comment as we run the quick poll. All right, Dr. Nandini, you good?
Yes, I'm ready.
You're ready. All right, we can begin.
Yeah, thank you so much. The topic, of course, was revolutionizing neurorehabilitation, but I think that was a misnomer. It was neuroregeneration. I've kept the topic as it is, but I'm going to talk more about neuroregeneration inside NeuroGen Brain and Spine Institute. That's what I'm supposed to talk. So I'm going to try and virtually take you inside this amazing home of mine, that is NeuroGen Brain and Spine Institute. It is not a clinic. It is not just a hospital, it is a concept. So how do I introduce you to the concept? I'll need about 10 minutes to do so. So first of all, let me be upfront and say that this talk is just for information. It is not a substitute for any consultation, and every individual with a neurological condition needs specialized treatment and will need assessment and treatment based on his or her condition. What I'm going to talk to you is based on scientific data that we have published over the last 16 years. NeuroGen Brain and Spine Institute physically is in Navi Mumbai, a very, very beautiful out suburbs of Mumbai. Mumbai is very crowded, but Navi Mumbai is beautiful. It is very well located. This particular institute near Seawoods is located very near a beautiful lake. We get a lot of flamingos in the summer here, and this place, Navi Mumbai, is very well organized, and it's near the new and upcoming huge international airport of Mumbai, which is coming up just 10 minutes away from where we are. We have treated almost 16,000 patients from 100 different countries from all over the world. In fact, patients came from places where we have not heard of, and thereby we grew more and got enriched because our family grew with the number of patients who came to us. The core team is a very, very senior team. We are headed by Dr. Alok Sharma, who is a director of our institute, who's a neurosurgeon, who is a vision or a visionary behind this whole concept of neuroregeneration. If you look in the name of NeuroGen, that is NeuroGen. So basically, we are talking about generation or regeneration of the brain and the spine, which so far was thought not possible, but has been made possible in the last 16 years. And I will be presenting evidence of the same. Myself, Dr. Nandini, again, my focus is on research on brain development and using of cells or stem cells to regenerate the brain and spine. Dr. Prerna Bade, who is the head of the Neuro Lab, is the main core who makes the cellular therapy happen. And Dr. Himangi Sane, my colleague, also a deputy director of NeuroGen, head of research, an amazing doctor and medical person herself, an MD in internal medicine, herself suffering from a neurological condition known as amyotrophic lateral sclerosis. And you will identify it with Stephen Hawking, a Nobel laureate in physics, who himself suffered from this condition. Dr. Himangi is a survivor. She's a recipient of the cellular therapy or the autologous bone marrow grafting that we do, and is alive and well doing research and also looking at patients. When you come here, you will meet her. So this is the core team, and what we are doing, and together under our supervision, we have a team of more than 150 doctors and caretakers working together to provide to our patients a comprehensive multidisciplinary approach. That is very, very important for us. It should not be one phased, it has to be multi-phased, it has to be three-dimensional, four-dimensional approach. The core of it is the cellular therapy or the regenerative medicine treatment, along with a very comprehensive neuro-rehabilitation program under one roof, along with oxygen-based integrative treatment, along with gut, looking at the gut and understanding the gut and looking at the blood parameters. So we are looking at everything. And I will talk to you more in detail, taking autism as an example of how we approach a neurological condition. So, what is the main base of our treatment? That is the regenerative medicine. We believe that the brain can be repaired, and we have shown it in many of our patients multiple times over the last 16 years. So, what the old thought or dogma was that the brain once damaged cannot be repaired. But over a period of last 16 years, we have shown that it is possible to repair the brain. This is an example of a brain scan. The blue part is damaged, the cells will go and help repair. And this is revolutionizing the way that we look at neurological conditions. Neurological conditions, sadly, are the most neglected of all conditions in medicine. And most of the time it is said that once the brain is damaged, cannot be repaired, and the patient is left on his own. However, we find that there are improvements and we can repair the brain to some extent. How do we know that the brain has capacity to regenerate? Just think of yourself. You are watching me today on this webinar from so far away, and you are listening to me, and I'm hoping that you are paying attention to what I'm saying. And over a period of next 1 hour, you listen to me. After some time, maybe after 3 months, 4 months, 5 months, sometime somebody will talk about me and you will remember me. How do you remember me? That is because the part of the brain known as hippocampus, the cells are multiplying, they're converting, they're networking and forming new memories. Memories are the way that which are telling us that the brain cells are still multiplying. So the brain has capacity to multiply and form new cells and connect and form new networking and memory. All we are doing with cellular therapy is facilitating it. So how does cellular therapy work, or what you know as regenerative medicine or stem cells, how does it work? So how does it work? You have a stem of a tree, and stem of a tree, when you give growth factors, it makes branches, and then it gives rise to leaves and flowers and fruits. Similar way, there are cells in our body which multiply many, many times, and depending on where you put them, if you put them in the liver, they become liver-like cells. If you put them in the heart, they become heart-like cells. If you put them in the brain, they can help the brain regenerate. Sorry. So how do these cells work, and how are they different from anybody else? So what do they do? One cell becomes many, many, many cells. So one cell can multiply many times. One cell can become thousands of cells. When we put them into the brain, they help reduce the inflammation. This is known as immunomodulation. So any swelling or inflammation in the brain is reduced. It helps to form new blood vessels, thereby release of growth factors, release of oxygen. Oxygen is the molecule which helps heal different parts of our body. So cells will help form new blood vessels known as neoangiogenesis and help the brain release, help these cells release growth factors to repair the brain. Then it also prevents the death of the cell in the brain. So all of these together help the brain to revive or heal. Now, the field of regenerative medicine has been evolving for many, many years, and this concept of regeneration is there in our textbooks also. The Harrison textbook of internal medicine, which is the Bible for us, also has this particular section or chapter telling us that yes, you can possibly treat Alzheimer's and ALS and chronic strokes and traumatic brain injuries. And I'm going to show you how that is possible. So is this something new? Many people think that it is a quack treatment or it is a quack. Is it? Just look at this. In the field of medicine, nowhere in the history of Nobel Prize, which is one of the biggest accolades of our times in terms of scientific awardship, no area of medicine has got 3 Nobel Prize in the history of their own research, but in the field of regenerative medicine, the first ever Nobel Prize was awarded to Dr. Thomas for the demonstration of stem cells from the bone marrow. The second came in 2007 for Sir Martin Evans for the isolation of embryonic stem cell in mice. And the third, more recently in 2012, to 2 professors, one from the US, one from Japan, where they looked at making our skin cells into embryonic stem cells. That's called induced pluripotent stem cells. So 3 Nobel Prize in the last 40, 50 years. So that's a huge, that tells us about evolution of this field of medicine. So Stephen Hawking, the Nobel laureate, who himself suffered from a life-threatening motor neuron disease, spoke about
exploring the mysteries of the
stem
cosmos.
cells from our own body.
But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us,
which have special powers. They are called stem cells.
What Stephen Hawking is saying that you have capacity to repair your own body. Your body has stem cells within. You don't need to reach out outside. It is within you, the power to regenerate yourself. And that's exactly what we do at NeuroGen Brain and Spine Institute. We are, removing the potential, using the potential of our own body to heal our brain. So what do? We are using, what we are doing is autologous bone marrow derived mononuclear cell. I'll be explaining a little bit of what this is. We are using patient's own bone marrow from the hip bone, taking them out, separating the cells and injecting it into the spinal fluid. So that's a process of cellular therapy. Why are you using patient's own bone marrow? We are using patient's own bone marrow because these are safe. No tumor formation has ever been seen with this cell. It cannot be rejected because these are your own cells. They are easily obtainable with one needle from your hip bone. There are no ethical issues. We are not taking an embryo and killing it and using the cells. So the bone marrow is safest, non-controversial source of stem cells for treatment. In the bone marrow, what is the bone marrow? It is a factory of cells. So when you touch your bone, or you eat non-veg, when you eat chicken bone, you feel that it is hollow and there is something inside it. That's the bone marrow. That's where the blood is formed every day till we die. So bone marrow is a combination of many, many different types of cells. So this bone marrow contains a mixture of cells, and what we are using is the mixture of cells separated from what we do not want, and this is the cluster of cells that is then used to repair the brain. Once the cells are separated, we are injecting it, you can see in this picture, in the lower back into the spinal fluid. So these cells will go travels up the spine into the brain. If there is a problem in the spinal cord, it will go to the damaged part. If there is a problem in the brain, it will go to the damaged part of the brain. So these cells have what is called as homing instinct. What is a homing instinct? Like early in the morning when the bird goes out from the nest, will come back home only. This is called homing instinct. Wherever in the world the bird flies, will come back to its nest. So these cells have a homing instinct. They know where the damage is. They can sense it because the damaged part releases chemical or chemotactic agents, and these cells are attracted towards and go and repair only the part where there is a damage. So the cells will go via the spine to the brain and improve the brain functioning. The beauty of this is that the cells will not get diluted into the liver, heart, lungs, because we are not putting it into the IV fluid. We are putting it into the spinal fluid, so it will not get diluted and go anywhere. So the 3 steps, how do we do? First step is removing the bone marrow through a thin needle or aspiration. It's called removing the bone marrow like a thick blood, separating it in the laboratory in a few hours and injecting it back into the spinal fluid in the lower back, not in the spinal cord, into the fluid space once the spinal cord ends. So it's a simple procedure. There is no cut, there is no stitches, just one needle in the hip bone and one needle in the back. Completely natural, right? Like a mother's homemade orange juice. Nothing artificial about it, no chemical mixing there. So let's look at the video of this process. So bone marrow is aspirated. We can see that separated and injected into the spinal fluid. So this is the main process, one of the process of the complete holistic treatment. This is step 1. So the first part, if you remember, I said 3 parts. The first part is the cellular therapy. I explained to you the process of cellular therapy. Second part is comprehensive rehabilitation under one roof. Very, very important to, along with the cellular therapy, to add the comprehensive rehabilitation. Because when we are improving the brain functioning, we are working on the hardware, while the rehabilitation or training will be done by the software. So it's a teamwork. So it has to be a teamwork together. So cellular therapy and along with neurorehabilitation works together as a team, giving you fabulous results. So neurorehabilitation is a complex process and has to be multidisciplinary, and you need aquatic therapists, you need psychologists, a speech therapist, occupational therapists, and physiotherapists, all working with the nurse, a dietitian, neurologist all together. So every department has their own role, and at NeuroGen we have this comprehensive neurorehabilitation program. We have a physiotherapy center where we do physical rehabilitation, we do occupational therapy where a child or an adult is trained how to take care of their own activities. We have an autism child development center where the children are are able to play and learn at the same time. We have advanced therapies like aquatic therapy. Children love water, and when you do training in water, this is not swimming, this is doing therapy inside water, we have fabulous results. Along with that, of course, the sensory issues reduce and a lot of benefits, focus and attention improves. We also have a spinal cord injury tract where we train those who have spinal cord injury to stand and walk and do active rehabilitation. So this is ongoing therapy process. Sensory integration, helping children work on their sensory issues. We also have play therapy and speech and language therapy, art therapy, dance therapy. So all of this comprehensive neurorehabilitation adds on to the cellular therapy. So the second part was the rehabilitation. The third part we have added over the last 5 years. As we evolve, we continue to improve or find new ways to do therapies, and the combination basically contains hyperbaric oxygen therapy, ozone therapy, gut cleansing, acupressure, and deep tissue mobilization. So oxygen-based integrative therapies enhances the results of the cellular therapy, and I will talk a little bit about it. This is the hyperbaric oxygen chamber, and patient goes in and we give 10 sessions of hyperbaric oxygen, one session every day, which helps to complement the effect of the cellular therapy. So what is hyperbaric oxygen? Breathing oxygen at increasing pressure. What will happen in that? If you see in this picture, the upper part basically is the picture of a blood vessel. So when you breathe, now you are breathing oxygen through air. 20% oxygen at 1 atmosphere pressure. At 1 atmosphere pressure, this is what happens inside your body. When you breathe, oxygen goes into the lungs and from lungs gets filtered and then goes into the bloodstream. We all know that in the blood, oxygen is carried only by the red blood cells or the hemoglobin. So you can see here, this is the red blood cells depicted in red, and you can see this oxygen to O molecule, oxygen inside the red blood cell. This is at 1 atmosphere pressure. In hyperbaric condition, where the pressure is more, hyperbaric means increased pressure. In case of increased pressure, you can see the oxygen here is not only inside the red blood cells, it is into the plasma. You can see the oxygen flushing the whole of the blood. Just imagine your body completely flushed with oxygen from the hair to the tip of your nail at the toe. Every part of your body, the small parts, even where the cells are not able to go, this oxygen can go there and it will help repair those small parts where even the cells cannot reach. So now with the hyperbaric oxygen therapy, you are helping oxygen reach very small parts of the brain tissue where capillaries are not able to go, and stimulate the stem cells in the brain, stimulate the cells that we have put in the brain also, thereby enhancing the results. So it stimulates oxygenation, strengthens immunity, improves brain function, improves metabolism, increases energy levels, reduces fatigue, and improves overall functioning. That's one part of the oxygen therapy. The second part of oxygen therapy is ozone therapy. Now, this ozone is not the atmospheric ozone. This is a medical grade ozone. Medical grade ozone is a mixture of oxygen with ozone. What is ozone? Ozone is O3. Normally, if you see oxygen, oxygen is O2, right? You can O connected with two strong bonds. So that's a very strong connection. But the third molecule is connected by one single bond. So it's very flimsy. It's not a very strong relationship, but it is activated oxygen. It is also in gas form. And once it is put in the body, it has all these beautiful effects. It's a natural germicidal. It kills viruses, bacteria, fungal infections. It reduces the inflammation and swelling in our body. It reduces the blood clots. It acts an antioxidant. Antioxidant by reducing the oxidative stress and thereby reducing the possibility of, injuring any tissue. So in children, it is done in different ways. So while in adults, it is done in different ways. But this ozone is very, very safe, and it helps improve the gut of the child. It improves oxygenation, again, lowers inflammation, improves the gut health. It helps release good hormones and growth hormones, again, has an antioxidant effect, increases energy, and acts as a natural immune booster. The third part of our integrative therapy is cleansing of the gut. Gut cleansing is this part of gut cleansing is done in adults, but in children it is done using ozone therapy. The principle is that what you eat is important. What is there in your gut may actually be stimulating a lot of your diseases. So the gut has to be clean. So that is done through various ways. I will be talking a little bit about autism and explaining to you how the gut treatment is done in autism and children with cerebral palsy. Deep tissue mobilization or acupressure helps to, by putting pressure at specific point, helps to calm the patient, help reduce the muscle, fatigue. The other thing that we do as a comprehensive treatment is work on the diet and nutrition, especially in children. We suggest to avoid sugars, avoid, junk food, avoid inorganic processed food, give more of probiotic, work on the gut, gluten and casein-free diet. Vitamin supplementation, either intravenous or oral, is important to harmonize the vitamin levels in our body. In adults, it is done by intravenous route, and in children, it is done by oral routes. Now, why are vitamin important? Vitamin are important to help the cell live better, but the vitamins have to be given in activated form. I will again talk a little bit about it in later part of my talk. So different kinds of vitamins are given based on the blood levels. We do a complete assessment the first 2 days. We do detailed assessment of the blood workup. We do brain scans, and then the treatment is started. So this vitamin levels are supplemented based on actual level in the body. Supplements can be of different types, and again, it is customized based on the child's condition. Now, this is a broad outline of what we do, and what is our work based on is based on a whole lot of evidence generated over the last 16 years. With autism, 17 publications. So these are not articles in newspaper. These are articles in scientific journal. These are peer reviewed. That means this data that we sent to the scientific journal is reviewed by people in our field. They look at the data, they look at whether this data is authentic and whether it should be published, because it gives credibility to the work that we do. So 17 publications in autism, 15 in cerebral palsy, 4 in intellectual disability, 20 in muscular dystrophy, 9 in spinal cord injury, 6 in brain stroke, 11 in ALS, 28 in other kinds of incurable neurological conditions. So I think I can say this very proudly, that I don't think any institute in the world has, so many focused publications, 111 from one specific institute on neurological conditions and regenerative medicine. So which are the conditions that that can be treated by this comprehensive treatment? Autism, we have a lot of data. I'm going to talk more detail about autism because that is one condition we have a lot of data on. Cerebral palsy also, intellectual disability or mental retardation, muscular dystrophy, spinal cord injury, stroke, traumatic brain injury, a little bit about motor neuron disease, and a few other conditions. Prevalence in the world, if you look at autism, 70 million in the world. Cerebral palsy, 17 million. Intellectual disability, 7 million. Spinal cord injury, 5.6 million. Muscular dystrophy, 2 million. Stroke, 35 million. So Mr. Jimmy was saying that stroke is in large amount, but look at autism, double that of stroke. So it has overtaken even stroke in the prevalence if you look at it worldwide. So what's different about NeuroGen? Many people say that, okay, we also do cellular therapy, we do regenerative medicine, but what's unique about NeuroGen? Because one of my responsibilities today is to take you inside NeuroGen. I hope I've been able to bring you in for a little bit, but also to tell you why we are different and special. We are different because our focus, as our name indicates, is on neurological conditions. Our center works only with neurological conditions, no liver conditions, no diabetes, no lung issues, only neurological conditions, because our director is a neurosurgeon. So we believe in working in the field of our expertise only. We use safe autologous cells from the patient's own body and inject them into the spinal fluid so that it directly reaches the brain. Many people take cells from outside. Many people inject intravenously, so the efficacy is less. So we are direct to the target, and you save cells which have no long-term side effects. We combine cellular therapy with comprehensive neurorehabilitation and oxygen-based integrative therapies. So we are constantly evolving over the last 16 years. We have done a lot of research, having published 111 papers. We keep looking at what is a disease condition, what could be the cause, what's happening in the body, what more can we do to help our patients improve faster. We have a team of very senior and experienced professionals. As I introduced our core team, we have been together since the conception of this institute last 16 years, and some two of them, in fact, even before the concept of NeuroGen came into being. So we have been together for a lot of years, and together we, take care of the patients and train the younger ones and get them going ahead. We contribute to international books based on our credibility. We are invited to write book chapters on various international books and our experience in regenerative medicine. We are constantly researching into the causes and nature of nervous damage, as well as newer and better treatments. And our work, most important, is our work is monitored by a government certified institutional ethics committee, also known as institutional review board, which monitors our work on a yearly basis. So this is how we are different from any other center in the world. So what do we have? We have our in-house operation theater, which is state-of-art operation theater. We have an in-house cellular laboratory where the cells are separated, and this is within the operation theater complex. Nothing goes out of this complex that is with next to each other. We have comfortable living facilities. Patients live with us in our hospital. We take care of them like our family. We have also, as I said, written book chapters here, and we have a comprehensive rehabilitation program. Now, that was the initial introduction. Now, I will be walking you through our experience based on a maximum of would be based on our published data, and some of it is the new and upcoming data. So let's look at autism and other conditions. Autism spectrum disorder is a complex neurodevelopmental condition with problem of social interaction, communication, and repetitive behavior. It affects individuals of varying ages. And why do we have to look at it? Why do we have to find definitive treatment? Because there is a rapid increase in the prevalence of autism. This is CDC Atlanta data from the US. And I think the statistics in Africa and in Southeast Asia is not very well developed. So we will refer to the US data, and somewhere similar should be the statistics in our part of the world also. So in 2000, the prevalence was 1 in 150, and look at how it is increasing. In 2023, it is 1 in 36, and 2024, 1 in 31. So look at the number of patients that are increasing. It is almost like a pandemic in itself. So what are the current approaches? So current approaches is the only current treatment is neurorehabilitation, behavioral therapy, occupational therapy, speech therapy, educational interventions like special education. But there is really nothing to do anything with the brain. Whatever is happening, it's outside. So first of all, let's really understand what really is happening in autism. Isn't that what most of you want to know? This is NeuroGen's original research about what's happening in the brain. But what at NeuroGen we do is, as I said, a 360-degree viewing of autism. Autism I'm taking as an example of how we are approaching neurological conditions. So we will look at the brain, we will look at what's happening up and down in the blood, what's happening in the gene, which we can work or tweak to improve the brain functioning, and what's happening in the gut. Because gut has important effect on the brain has an important effect on the gut, and these are interlinked. So this is a 360-degree view of autism. So first thing, we are look at neuroimaging. Everybody understands and accepts that the problem in autism is from the brain, but nobody really looked at it. If you go to a doctor and you get your child evaluated, and what do they tell you? Looking at, oh, the child is hyper, doesn't speak, must be autistic, but nobody really looks at the brain. If you have a fracture of your leg, would you look at do an X-ray of your leg, or would you just go and start doing physiotherapy? you have to do an X-ray, right? Similarly, then why are we not looking at an important organ like a brain? So we will look at the brain. I will explain to you what have we learned over the last 15 years. We will look at what's happening in the blood. We will look at what's happening to change the blood issues, the genetic factor which affect the treatment of the child. Not the, I'm not going to talk about the cause of autism, the genetic cause of autism, but I'm going to talk about the treatment part where the genetics matter, and the gut dysbiosis, what's happening in the gut, in the intestine of a child with autism. So first look at the brain functioning, neuroimaging. When we look at neuroimaging, we know about MRI. All of you know about MRI, right? What is MRI? Magnetic resonance imaging. When you say MRI, you know. What are we doing? We are looking at the structure of the brain. So let me give you an example. If you have a chair in front of you, you do an MRI of the chair has 4 legs. That's what the MRI tells you. So what does MRI of the brain tell you? Structure of the brain, that all parts are in place, or they are, not in place or displaced or whatever. But we also need to know most of the time the MRI is normal. Then what is wrong? So we went ahead and looked at what is known as functional imaging. Means if this chair has 4 legs, does it mean that if I sit on it, will it take my weight? Or will it break? So that's what we are going to find out from a functional scan. How strong are these legs? How strong are different parts of the brain of a child with autism? Are all parts working absolutely fine? And we will see what parts are not working fine. Okay. In PET scan, what did we see? This is a PET scan of the brain. And if you see here, different color code indicates different functioning. The green, yellow, and red indicates good functioning brain, while the blue indicates the damaged brain. Okay, so let's look at which part of the brain is damaged. This is the brain, front of the brain. My cursor shows here front of the brain, top of the brain, back of the brain, and back and below. Okay, the main part, or the cortex as we call it, is all good. But if you find inner part of the brain and back of the brain known as cerebellum is functioning less. Now this part, which is called cerebellum, which is circled here in black, what does it do? It is a traffic police of the brain. It is important, whatever the main brain needs to do, this will execute it. So fine motor activity, coordination, balance, articulation, these are the problems. These are the things that this part of the brain will coordinate. The inner part of the brain, the hippocampus and the amygdala, this is for understanding, learning, comprehension, socialization, emotional expression. That's a problem in autism. Then there's a part inside known as thalamus, which connects the two brains together. That is the information processing unit, the sensory and motor processing. So these will tell us, yes, this is exactly the problem in my child, isn't it? Those who have children with autism, this will resonate with you. So if you look at these, you can see again the brain, but a major part of the brain is good. The deeper parts are affected. So this is something that we researched. This was very few people had really looked at the brain earlier, and we researched it. And this is publication in the World Journal of Nuclear Medicine, which we found and which we published in the year 2019. And this is what we found. Apart from finding that these 3-4 areas of the brain are functioning less, we found a pattern. What did we see? If you look at this graph, the orange here, the blue here indicates brain development in a neurotypical child, where you can see that the brain functioning is improving. Up till 10 years goes up very fast, and then after 10, between 10 to 15 years is going up, but very slowly. On the other hand, this orange graph, which was initially higher than that of a neurotypical child, is going down with age. So that means that the brain functioning is worsening as the age goes by. And what is very classical or very important is that as time goes by, the difference or the gap here is increasing. That's why early intervention, diagnosis early, treatment early is the dictum. If we are able to start treatment before the child is 5 years old, we can easily push this graph up. But if we do it when the child is 15 years old, it can be done, but it may not reach the level of a neurotypical child. So that's why early intervention here is very, very important. We also looked at the MRI. Most of the time, when you go do an MRI, also the radiologist will say brain structure is normal. But we did not accept that. We digged in deeper, we looked in deeper, we studied much more, and we found that the connection of the brain is affected. You can see here part of the brain, which is this thick bundle. It is known as corpus callosum, and in this picture you can see it, a light way has been explained. This is one part of the brain, this is the other part, and this corpus callosum is a mediator, it is a connector. And the connector helps one part of the brain talk to the other, and to have communication. So this communication part is developing very late. At the front part of this communicator and the back part, the size is smaller and it is more delayed in development. It's not that it doesn't develop, it just is delayed. And that's another thing that we see now. So the main structure is fine, but the connector is weak. So connection is weak and some part of the brain is weak. This is a new finding that we have, put forth. So that's about the brain. Okay. Now let's look at the biochemical findings, the blood. You look at hemoglobin, you look at sugar, you look at electrolytes, you look at the kidney, but more, we need to look at more. What do we look at? We look at the level of the vitamins in the blood. We look at vitamin D, we look at vitamin B2, B6, B9, B12. And what do we find? So what is found, and many parents, I think, are bombarded with a lot of information. There is mitochondrial dysfunction. No, this is a new discussion which is happening. Now, what is mitochondria? You've heard of the DNA. You know the nucleus. What is mitochondria now? So mitochondria is the energy producing unit of a cell. It's like the lungs of the cell. It is a breathing apparatus. So if the mitochondria or the breathing apparatus is not functioning properly, the energy formation of the cell is less and the cell dies faster, has difficulty in healing. So that is seen in many of the children with autism. And why does it happen? One of the possible reasons is the inability of the body and the brain to utilize B9 vitamin. B complex has B1 to B12, B9 vitamin, that is a folic acid. Though it is there in the blood, it is there in our food. Non-vegetarian diet has folic acid. Food which is fortified from the supermarkets has folic acid, but it is in inactive form. So it may accumulate in the blood. There's high level of folic acid, but no use. Why? Because there is a gene mutation which is preventing this folic acid from getting converted into 5-MTHF, which is the active form, which is important for healing of the brain, which is important for formation of new good chemicals or neurotransmitters. So I know this is a lot of information. I'm just letting you know that these are the things we continue to look at and find, and we may not be able to correct the mutation, but we have studied this and found that 73% of children that we have studied, more than 1,000 children, they have this gene alteration, which is preventing the folic acid from getting utilized. So that's what we studied. We also looked at neurotransmitters in the blood. We looked at, what is up, what is down. Serotonin is up, down in the brain, blood. So a lot of study to finally be able to give the supplements as desired. So we have done a whole lot of this study. I'm not going to go too much in detail because it will be overloading. But just to let you know that we are doing all this study to be able to, add value to the treatment that we are doing, because this is important. Now, the third part is a genetic. So genetic here is not for knowing the cause of autism. No. What we are doing is, which I explained, to look at whether the vitamin is being used, whether methylation is happening, whether there is a mitochondrial dysfunction. We find, as I said, folic acid not being converted into an active form. That particular pathway is not working. So if this is not working, this active form is not being produced. This tells us that we have to give the child this supplement, not the folic acid, but the active form, that is methylfolate. So this is what we do. We look and we study and we give supplements accordingly. So nothing is done without study. So that was the third part of the autism treatment. And the fourth part is the gut. We have now started looking at, that children have constipation, gas, very, very hyperactive, aggressive, crying and laughing without reason, not able to settle down. And that's from the gut. So we do study the linkage between the brain and gut. The brain controls the gut movement, but once the gut movement is slowed down, the fecal matter, the waste is accumulated in the gut, doesn't go out fast enough, so toxins get absorbed and they affect the brain, and all of this then affects the child. So at NeuroGen, we improve the brain functioning using the cellular therapy, but we also study the gut to see what is wrong, and we correct it using ozone and medications. So what do we see in the gut? How do we do the gut testing? Using simple, the stool sample, the poop of the child. The poop of the child is studied. And what do we find here? We find unwanted bacteria in 47% of the children. They are not having any loose motion, but their gut has Shigella and E. coli. So we need to treat with antibiotic. 27% and 11% have Candida and Aspergillus fungus in the gut. 39% have, amoeba in the gut. All of this is causing problems. It causes stereotypical behaviors. It causes problem in social communication. It also sometimes causes seizures. There can be behavioral issues, aggressiveness, problem of communication, and stomach cramps and nausea. So hence, a simple poop test will tell us all of this, and we can. Why this is important? Because it is correctable. We can give medications, we give a treatment regimen and correct it. So how are we working on the brain? Not just using cellular therapy. We look at the brain scan. We look where is the problem. We are correcting that with cellular therapy. We are giving hyperbaric oxygen. We are giving ozone therapy. We are doing gut. We are looking at the blood. So whole lot of things. So not just one thing. That's why it's taking time to explain. Okay. So what are the unmet medical needs, and why do we need to go away or in addition to conventional therapies, right? So all this background was to why do we need regenerative medicine? We need regenerative medicine because the current treatments is not focusing on the brain damage. It is just focusing on training the brain so far. So that's where we are using cellular therapy. Now let's look at the results. So results are based, whatever I'm presenting today is based on whatever we have published. Autism, I'm not going to go into that. We know what it is. The world's first ever publication where it was shown that autologous bone marrow cell therapy, which I just spoke about, can be used in autism, came from India, came from NeuroGen Brain Spine Institute. We are very proud of this achievement way back in 2013, where we showed a data of 32 patients. That was preliminary, and we found 91% success rate. The second publication from our institute came in 2020, published in the American Journal of Stem Cell, where we looked at the data of 254 patients using the same protocol. We found improvements in all these different parameters. Social interaction improved in 67%, eye contact improved in 80%, attention concentration in 80%, stereotypical behavior reduced, hyperactivity reduced, self-injurious behavior reduced, sitting tolerance, command following, so speech, all of these improved to different degrees. We looked at age-wise. We found that children less than 5 years have the best possible result, almost more than 95% results. Between 5 to 10 years, 90%. Between 10 to 15 years, again 90%, and over 15 years, 90%. So as the age increases, possibility of success reduces by 55%. When we looked at the PET scan, right? I told you we do an objective brain scan, functional scan, which is the hardware. So when we look at the brain, if you look at the brain scan, the green and yellow part is good functioning brain, and the blue part here is functioning less. This is before the treatment, and 6 months later, we look at the brain again. You can see that the blue part is reduced, green part has increased. This indicates that the brain is healing. This is another picture before and 6 months later. You can see the difference. You can see here again, the blue, that is the cerebellum, is now green. The thalamus is now more green. So now the brain functioning is improving. Now, the latest, just about a week back, our data of 1,011 autism patients got accepted for publication in clinical transplantation and research. So I don't think anybody has really published such a big data of 1,000 patients. 1,000 is not less. We have treated almost 6,500 to 7,000 patients of autism in the last 16 years. But of course, the analysis and following up takes time. So we have published a data of 1,011 patients, and with a follow-up of almost 20 months, not a small follow-up, almost 20 months, 1.5 years. Again, we found improvement 78 to 65 to 82% in all these different symptoms. You find improvement in attention, concentration, command following, eye contact, sitting tolerance, social hyperactivity, communication, speech improved in 60%. And we found that on ISA score and CAR score, these are objective score, 85% showed improvement. Improvement in all the different domains wherever there is a problem in autism is significant. And when we look at age-wise, again, we find if you look broadly, about 89% possibility of improvement in less than 5 years, 87% in between 5 to 10 years, 10 to 15, 84%, 10 to 15, and above 15, it is lesser. So as age increases, lesser. But when we give multiple treatments over a period of a year and a half, we find the results improve. So with one dose, the possibility of success is 71%, but with two treatments, it goes to 96 to 97%. And 99% with more than two doses. So every time you give an increment treatment, the possibility of success increases. And when you look at age-wise also, you can see that 0 to 5%, you can see 77% to 100% possibility of improvement in less than 5 years when you give multiple doses. In 5 to 10 years, again, 75, it goes to 96 and then 100%. And 10 to 15, it's slightly lesser, only slightly, but you can see a good improvement when you do multiple doses. So this indicates the possibility to get a good result, you may need multiple doses. When you do the PET scan, you can see again improvement. This we have published before and after. When we add oxygen-based therapy, this is not a published data, let me be upfront, but we looked at two groups where we did only cell therapy and rehabilitation, and cell therapy and hyperbaric oxygen, ozone and rehabilitation. And we found that only with cellular therapy, possibility of success, if it is 56%, then here it becomes 63%. So these are the symptoms, and we can see all the symptoms, only cell therapy with oxygen therapy, almost 6 to 10% better improvement with oxygen-based therapy. So that's how we are looking at improving here. You can see using different scores. I saw score 82% when only cell therapy and 89 and 90% when you add. So possibility of quantitative and qualitative improvement, and the brain scan also better with oxygen-based therapies. So these are our 16 publications and textbook, all available online, freely available, and you can see. Worldwide literature, what is evidence in the world? First paper from India, second from China, third from Italy, fourth and fifth from US. So US is much behind. Sixth from India, again, that is our publication. Seventh from Vietnam, eighth from Iran, ninth from US, 10th again from Vietnam. They did the same study as us. And 11th again recently from India. So much data is there. An example, a few example, this is a 18, now 20-year-old boy, came to us when he was 11-year-old with mild autism, had fleeting eye contact, low self-awareness, sensory issues, stereotypical behavior, temper tantrums, all the classical symptoms. But here we can see that treatment, before he had his understanding or the reading level was a 3rd grade, 4th month level. In 5 months, it went up to 7th grade, 1st month. All the symptoms improved, eye contact, sensory issues reduced, speech improved, ability to socially interact improved, brain functioning improved. This is after 2 years. He went from a special class to a mainstream class, and this was his result, A in most of the subjects. And he did exceptionally well in English and Spanish. So this is like for us a crowning movement. And when we followed him up, if you see from 2015 till recently in 2018 off the spectrum, and this was him about 2 years back, he passed 12th grade. He went to a summer trip from US to Ireland, England, France with a group of boys. He did summer job. He applied for college himself. And this is his mother talking about her experience, but I think I will skip to example from Kenya. This is a boy, one of the triplets who came to us. All three were on the spectrum, but at different severity. I'm going to talk about one of them. Ricky here is now 12 or 13 years now. He came in 2017, where we had difficulty in being able to wash his own clothes or bath alone or engage in perineal hygiene. That improved. He now knows money concept. He can take care of himself. He can now play a piano. He understands. He's completely verbal. He can have a conversation. Autism, he's off the spectrum. He now has only ADHD. He takes care of his siblings. He understands social boundaries. He knows money concept. So over the period of last 6 years, this is how his score developed from 26 mild autism to 21.5, 20.5. Then he went into high functioning autism, different scoring, and now he is high functioning autism with minimal symptoms. His social age went from 6 years, 9 months to 10 years, 3 months. So just about 1 year behind his actual social age. So let us see this video.
I remember one time coming home and the nanny telling me that she has been told that my sons should not go out. People, parents, please lock your doors. Those who don't want my sons to get into their houses, please always keep your door locked, because there is no way I'm going to close my children in the house. Autism is the cancer in my house, and I have 3 cancers in my house. Mothers ask me, Mercy, you're so strong. How do you do it? You know, 3 kids, we are collapsing with one. How do you do it? We have targeted everything, our time, our resources, our energies towards eliminating this monster.
The boys were born in 2011 in California, US. They were prematurely born.
1 year went, their milestones were okay.
Each boy was moving separately and not getting together, and you could see that the attention span or the attention was very limited.
But as they grew up, we realized that these boys are just too active. By then, I would have expected when I call Eric, Lenny, or Rick, they would be able to respond. So I thought it's because the 3 of them, no one knows their names. The boys also didn't seem like they were recognizing their mother.
We expected them to have developed speech by 3 years, but they did not.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that.
The first time I saw them in a classroom, they were all over the place. You would see Lenny climbing up the windows, Eric somewhere under the table. Ricky was a bit mild, but he still had his own challenge.
ABA, occupation department, psychology, nutrition, physiotherapy, speech therapy, all these things under one roof.
We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes and he is asleep.
It's a big video, so I'm going ahead
of Nairobi,
so that you can see how they are now.
he's doing so well without even shadow teacher, and he's even doing academics, which I had no dream for my sons doing academics.
I'm very happy because when he went to the regular school, he coped very, very well. And the teachers there are able to work with him.
Just seeing the PET scan results, seeing all that blue coming down, we were told that Eric has had 60% improvement, Lenny 40% improvement, and Ricky, we were told just a few more points and he'll just get off the spectrum completely.
This means our children in future are getting to be cerebral.
Earlier, so I hope I will see whether, so now they are doing cyclotron. You can see them, go on. There's a video of them recently. This is the three of them. They will be now riding a bicycle,
There will be a long
supporting
day.
each
Something
other.
else, no hiking alone. We are
So
quite a number of us,
three of varied
so
interest, and now
whenever
this
we
is
are,
Rick, and he will take care of
your
his
friends,
siblings.
and also make sure
You can see here that they are riding in the busy streets of Nairobi. They are riding the bicycles. So you can imagine autistic children in Nairobi. Those who are from Nairobi, you will sympathize. So they finished the race, three of them. So for us, this is a proud moment. This is, of course, Rick going on a hike with a group of children and doing very well. There's another girl from Nairobi. She is now 5.5, 6 years old. She didn't have any speech. She had no comprehension, low attention, and she had a lot of sensory issues. And with 2-3 treatments now, she is socially adept. She goes to school. She studies. She can speak completely. She can have a conversation, play with the toys, can sustain attention. Her autism severity go from 36 to 35. Her ISA went from moderate to mild, and her ability of or social age went from 2 years, 7 months to 4 years, 10 months, very near her actual age. This is a PET scan before the treatment. The blue area is now looking green. You can see the brain before, and brain now completely activated. Let us see if I can find a video of her.
Eliana has something unique that we need to note, because whatever she has in her mind, I believe Eliana one day will surprise us. Eliana is a gift from God. My name is Jane. I'm a mother of 3.
Eliana was born as a normal child.
At around 1 year, she had speech. But at around 1.5, she went mute. Never seen of you talk, then you regress.
When we went to the doctor, that's when the doctor realized the girl didn't have eye contact, couldn't respond to her name, and also the issue of speech. The doctor told us to start therapies. We tried engaging her. We reduced screen time. For close to 1 year, we did all that. It didn't work.
Every time I would go to Google, I would see symptoms of autism. Some of the kids' tiptoes. I would see it with my girl. But the doctor took me that journey to understand what autism is. When I was told about the diagnosis, first I saw the end of me. I couldn't handle it. How am I going to handle her? I'll handle her, she's dependent. I'll do everything. What about when I'm not there? What will happen? It was not easy. I was very down. I used to cry.
And he told us there is a solution, which is about stem cell.
I was afraid. I mean, you're talking of the brain. Now you're sending me to India. My girl is being to be operated, or what will happen?
Told him our decision, and he was very happy about it when our journey started to NeuroGen for stem cell. Dr. Sharma is a special doctor who is interactive. For example, when you do stem cell therapy, he comes to your room personally to follow up. check the progress of the child, and also explain to you how stem cell works.
Dr. Arok Kim, he told me, this girl in 2 years' time, she'll be totally a different girl. Believe me, that hope. The hope that they give us parents who are hopeless, who have seen the end of the world. When I did stem cell, things changed. Eliana's first improvement was speech.
After the first shot, the first word Eliana said after stem cell, I think the second day, Daddy.
Daddy? Talk with the teacher.
Which was very emotional to us.
Immediately after the first.
What did you do to your daughter? She's different. She's calm. She started babbling, saying some few words here and there. She's always the best in class, competing with the other normal children. That's why we decided to do the second and shot. We have various therapies at NeuroGen, including...
He was on spectrum.
My advice is stem cell.
So this is, if you have time, I will finish the other conditions. Cerebral palsy, a lack of oxygen at the time of birth, very common in India and African countries because lack of primary health care. Depending on the severity, the child can have damage in one part of the brain leading to hemiplegia or one side of the body not working or completely neck down paralyzed or waist down paralyzed. So this is the brain scan and the black indicates dead brain, but the blue part is what will be salvaged. Medical treatment is mainly medicines or Botox or anticonvulsants, but nothing really addresses the brain functioning. And cell therapy helps to activate. You can see the damage here got activated. And this is our study of 40 patients. And this is a diplegic patient below waist, not able to sit, stand, and walk. The improvements in what we see is improvement in better trunk control, ability to stand, walk. It may not be completely normal, but slow, steady improvement and reduction in tightness. Quadriplegic, those who are neck down paralyzed, First is neck holding, sitting, oromotor, tongue movement, chewing, understanding develops, and then standing and walking. This takes time. So you can see the brain damage. Here is the damage before the treatment. This is 6 months later. You can see that the damage has improved. So when we look at the outcomes with oxygen therapy, when you add oxygen therapy, we find that the improvements are again much better. We see neck control improvement almost 6% more, and sitting balance again 6% more when we add oxygen-based therapy. Standing balance improves from 46% to 57% when you add oxygen. So when you add oxygen-based therapy with cellular therapy, even in cerebral palsy, you see better brain improvement in the damaged brain. And these are our publications and our book. And if we see in the world, there are 52 publications in the world with 92% overall success rate. This is a boy from Kenya who we treated a few years back. When he came, he was 14 years old. He was wheelchair bound. You can see before and after. I don't really have to explain. Sitting balance improved. He was able to remove his shorts. These small things matter to patients. It may not matter to you and me, but for them, it is very important. For the family, it is very important. Ability to sit, stand, walk, use of hands, fine motor activity, better use of, and then from wheelchair, he went to walking without support. This is another child from India who was level 4 of in severity and could not sit, could not stand, could not walk, could not speak, could not go to school. In 22 months, he started sitting independently, standing without support, walking with a walker. Where he was unable to speak, he could now speak sentences. Now, because he is able to walk with support, he can now go to school, and he started going to school. His severity level went down from 4 to 3. And his gross motor function improved from 41 to 58. And this is the brain scan before the treatment. You can see a lot of blue areas before the treatment. This is after the treatment. The brain damage has repaired. This is a video of the child. You can see earlier he had difficulty in rolling, and now he can You could roll better. It has to start from tongue control. It's not a miracle, it's a science. You need a lot of work. You have to do therapy regularly. If not with therapists, you have to give time to your child, whether it be autism, whether it be cerebral palsy, whether it be intellectual disability. So standing improved, and then walking with support, and then slowly even climbing stairs. So this is about cerebral palsy. I'm going to skip some of the examples and now go to intellectual disability or mental retardation is what you know. Again, brain functioning is low. You can see the PET scan showing blue areas. And before the treatment, you can see blue area. And after treatment, the blue has become green. So the brain is now healing. First ever in the world, again, NeuroGen was the first to publish a proof of concept paper again that autologous bone marrow cell therapy worked for intellectual disability. What did we do? We took 58 patients, 29 had taken the treatment, 29 had only rehabilitation. And what did we find? We found that those who had done only rehabilitation, that is the orange graph or orange bar, 20% did not show any improvement, 80% showed improvement to different degrees, 37% showing mild improvement, and only 13% showing significant improvement. Whereas in the intervention group where cell therapy was done, there was none of the patient who showed no improvement, but 62% showed significant improvement. So that's a qualitative and quantitative shift in when you do a combination of cell therapy with rehabilitation, you see a shift towards significant improvement. And that's what we believe happens. So this is the brain before the treatment, all the blue areas now green. So this is how the brain revives, regenerates, and learns. These are publications. I'm going to go to the next. Down syndrome. Down syndrome is a chromosomal condition. The trisomy 21 number chromosome, instead of being 2, it's 3, and leads to, mongoloid child. Eyes are different, ears are different, neck is short. There can be a heart condition. There can be hole in the heart. There can be hernia. But brain functioning is also affected. IQ may be low. So other parts of the medical and surgical treatment have to be done by other experts. We can help improve the brain functioning. So this is again the brain scan before and after the treatment. You can see that the blue areas here are functioning less. They have become more green. So the brain functioning improves. Let's look at example of a 12-year-old girl from India who showed improvement. They have also motor difficulties. Tone of the body is low. She's 12-year-old and could not climb the stair. You can now see that she can do it. Her understanding and puzzle solving improved. Earlier, she needed a lot of support. So understanding improved, ability to do activities improved. She started learning weeks of the days. Motor control improved. Earlier, she needed support to even jump, but now she's able to do the jumping. She started recognizing numbers. Even before, earlier, she used to go for therapy, but she did not show so much progress. In 12 years, which after the cell therapy, within 6 months to a year, she started helping the mother in the kitchen. She could do motor activities better. So both physical and cognitive improvements. So speech was not clear. This is before.
5. 5. 1, 2, 3, 4, 5.
She started learning things quickly. Now she can dance, she can groom herself, take care of herself. So many things she's able to do. Muscular dystrophy is a degenerative condition of the muscle. It is a genetic condition. You can see that with age, the amount of the brown that you are seeing here, it becomes less and less. Muscles are reducing and the fat is increasing. And at the age of, between the age of 16 to 22, these young boys with Duchenne muscular dystrophy, they die. Our data shows of 1,500 and more patients that we are not able to completely stop or reverse the condition, can slow down the deterioration. This is data where we can see that the green, the blue is graph of survival, or how long do they survive. They go down quickly when no treatment is done with cell therapy. They are stable for a longer time. The green indicates after the treatment. So the survival of boys with Duchenne muscular dystrophy increases, and their ambulation or walking is for longer time. An example of, again, where I'm very proud to be associated with this family, very, very diligent, from Nairobi. This young man is coming again for treatment next week, or this coming week. He's now 18 years old. He was 8 years when he came. This is how he developed. He had difficulty in walking, climbing stairs. Balance was a problem. So first few treatments, we were able to get him to improve and stabilize. His walking became better. Climbing stairs was possible. They had now new hope. At 18 now, he has passed 12th grade and he will be going to college. He is not completely ambulatory now. He does use a electric cycle, but with help of his father, at least he's able to walk a few steps. So we have been able to delay the complications which come with this treatment. That is the complications such as breathing difficulties and cardiac issues, and also the deformities in the hands and legs. We have been able to delay, and so the hope of surviving and having a better quality life is better. Spinal cord injury, when there is a damage to the spine because of accidents or because of a fall, all these publications from our side. Let me quickly go to a video to show you how a patient can improve. This is a 19-year-old boy from Nigeria with a cervical spine injury, neck down paralyzed. And let's see his journey. He had a road traffic accident in 2020 with a C6 vertebral fracture, paralyzed below neck. And after cell therapy, he stayed back for exercise, and earlier he had to be carried physically. You can see on the left side, on the right, that his control improved, and with very little support he can shift from chair to wheelchair. Earlier he had a lot of tightness and his leg would have spasm and would be bent all the time. Now you can see that we are able to keep his leg straighter. His truck control, you can see he had needed so much support, but then he was able to roll and come to the kneeling position or all fours by himself. So these are important improvements. Hand functioning, he had very little power in his fingers, that improved. His hand improved, sitting balance improved. Now he could sit without hand support, so that's a dynamic balance. He didn't need support with his hand. And remember that this patient is neck down paralyzed. Balance improved, then we made him stand. Earlier he needed so much back support. You can see there is a back support, but after the treatment in a month, we started having better control, and we made him stand at a parallel bar. And then 25 days of rehabilitation, we started moving his legs from the hip. But all this is with a lot of therapy, and then pen grip improved and he started writing. He could start moving his ankles, start using the keyboard. So very, very important to combine cell therapy with rehabilitation. Brain stroke, when there is, Ms. Jimmy mentioned about brain stroke. Brain stroke patients also improve. We also have publication. You can see very severe damage in the brain before the treatment. A lot of blue areas. Not everything is salvaged, but a little bit can be recovered. You can see one part. This is actually a brother of a friend of mine, very dear friend, when there was, he's a pilot and had a stroke. And though he had no habits, no cigarette smoking, no alcohol, nothing. Young a man of just 38 years old. You can see he had a craniotomy, and one part of the brain is completely not there. This is before the treatment. After the treatment, though this part will not come, but the other parts are now activated. The yellow and red means activated brain. You can see that the low functioning area are activated. So he could not speak at all. He had complete language aphasia, and he had problem in the hands. Also, you can see that after the treatment, slowly some improvement was seen. Let us see an example. So earlier, right side was weak. Sorry. Okay. So mainly hand function. I think the video doesn't have a speech. There's a problem with the video. I apologize for that. Head injury. I'm very proud of patient which I want to talk to you about. Severe head injury. Head injury improves very well with cell therapy. You can see the brain damage here. Just see the whole of the brain is blue. This is 14 months after the treatment. It is completely activated. And this boy was in coma. He was in comatose condition and he improved. And he was in merchant navy. He fell on the ship, had some kind of a head injury, came to us 6 months after the head injury. This is how he was. He didn't have any expression. He didn't had very partial, consciousness. We worked very hard with him. He had a tracheostomy. He had a Riles tube. We removed that. He was not oriented to where he was, what was happened to him. He did not know anything. It's severe tightness. Hands and legs were completely tight. Legs were completely deformed. We did cell therapy. We did almost 80 sessions of hyperbaric oxygen with him. And look at the changes after 14 months. This almost vegetative state person slowly, you can see sitting with support, looking at things, speaking. He's telling that he's having pain. So started speaking, better eye contact.
ताऊजी किधर है ताऊजी? राइट वाला हाथ ऊपर करो, सिर के ऊपर जाना चाहिए, सिर के ऊपर, सिर को टच करो.
You can imagine he's vegetative, this boy. And see where is he now.
हाथ से नीचे रखो हाथ.
Almost as if he's come back from death. We did a leg surgery, got his legs straightened out. He's able to move his legs, he's able to move his hand, he's able to, the tracheostomy was removed, he's able to breathe independently, he's able to eat independently. He can speak on a video call, he can tell what he wants, he speaks to his friends, he remembers the past events. He just doesn't remember how he had the accident. He can now read. He is now able to eat and chew and swallow. He's trying to eat by himself with assistive devices. Now he's trying to walk. So there are other conditions. I'm going to go straight ahead. I'm not going to talk about cerebral ataxia or motor neuron. So looking at adverse events, there are no major adverse events. These are patient's own cells. There is no neurological deterioration, but there can be a headache after the treatment for 2 to 3, 4 days. There can be nausea, vomiting, sometimes increase in hyperactivity in some children. And those who have a history of seizures or convulsions or epilepsy or EEG is abnormal in them, there is a 3 to 6% chance of having a seizure after the treatment. We have published this I think nobody in the world really publishes negative results, but we have published because we believe in finding solutions even for negative. So we do prior treatment to ensure that seizures do not occur. All the work that we do, as I said, is under the oversight of the Health Ministry of India. To conclude, neuroimaging technologies are giving us more information. We must use them to know which parts of the brain are affected in autism, in cerebral palsy, and other conditions. We are looking at biochemical investigations to understand the pathway affecting autism. New multidisciplinary approach is important and which is safe. So cell therapy by itself is not a cure for ASD or cerebral palsy. It needs conventional treatment, rehabilitation along with cell therapy. So this is our approach: newer brain imaging, conventional rehabilitation, special rehabilitation, cellular therapy, and oxygen-based integrative therapies all together. A holistic approach is important. So the best results are achieved when you accept that your child has a problem and accept the child the way he or she is, by understanding what is happening to your child, working together as a family unit, having a schedule in a day, along with cell therapy, comprehensive rehabilitation, correcting the gut and correcting the micronutrient imbalance. So this is the way our process works. Every person is assigned a coordinator, and the coordinator will help you reach we help with our processes. We have 2 treatment programs, 1 week and 2 week. 1 week starts on a Sunday, finishes on a Saturday. Sunday, Mondays, all evaluation, testing, and Mondays, brain workup. Tuesdays, actual procedure. Wednesday to Saturdays, or rehabilitation and discharge. In 2 weeks program, Sunday, Monday, Tuesday would be the same, but Wednesday onwards, along with rehabilitation, integrative therapies are also started.
मैं जापान गया
This is our Prime Minister
तो
talking
जापान
about
मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या
stem
जोड़ा
cells in the
मैं
parliament.
वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है
He's talking about stem cell
मैंने
research.
जितना पढ़ा था तो मेरे मन में आया था
Lemon
शायद
the Nobel laureate.
इनकी एक खोज हमारे काम आ सकती है क्या हम गए तो वहां गए
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So,
Today,
everybody knows about the so-called banning of stem cells in the US. People don't know that the ban was lifted by President Obama, but they lost 8 to 10 years in that the East took over that journey and went ahead. So this is a journey of hope, of faith, of looking ahead, and this combination treatment or holistic approach is what we offer to all our patients to get them to live a good quality life. Thank you. I'm sorry I took more time. It never finishes in 1 hour. Still, I ran fast with it.
No worries. We are quite appreciative of the information. I think you're full of knowledge, you're passionate, and we appreciate that. And I know I've learned a lot that I didn't know. I've seen miraculous things happen because I know we have various patients here in Kenya that suffer from head injuries, and they are left as a hopeless case, in short. And I can see that there is hope for those who also suffer from such conditions. I know we have a really big population also in our country that suffer from also cerebral palsy, and I can see that they can walk, stand, right? Even trying to feed themselves. So that's really, really, really huge in terms of advancement in neurorehabilitation and neurodegenerative, neurodivergent conditions such as autism. So thank you for taking time to touch on autism. I wish we have a side session so I can learn more. But we'll be looking into your publications. Thank you for sharing that too. And right now, I have a few questions that have been asked throughout the session, and then we'll do a poll just before the end of the session so that we can get some feedback from our audience. And so the first question, and I think it was partially answered from your presentation, and that is the correlation between gluten issues and gut issues, that is gluten, and autism, CP, and ADHD. The correlation, just a slight more explanation on that. And then in terms of epilepsy, the condition itself. What are the results of stem cell therapy in epilepsy? The other question also
Questions are
gave,
coming. Yeah, I can see the question. So let me answer the first one about gluten or gut issues with autism, CP, and ADHD. Gut issues in general do have an effect on many conditions apart from neurological condition. In autism and cerebral palsy or intellectual disability or ADHD, what we find is that if there is an intolerance to gluten or casein, that leads to antibodies in the body, leading to their inability to use these food appropriately, leading to a lot of gas and constipation and thereby increase in the symptoms of the autism. So that's why it's important. We do also suggest that try and avoid gluten and casein and sugar and inorganic processed food, pesticides. So these things do affect the development. Some of these intolerances do lead to leaky gut issues, also causing the brain functioning to get affected. So yes, there is, so it may not be the actual cause, but it may be a stimulant, or there's a possibility of increasing the severity because of these intolerances. Now, treatment of epilepsy treatment will need medications. We do not treat pure epilepsy. We treat conditions like cerebral palsy and autism along with epilepsy. So pure epilepsy, no. But those who have comorbids as an epilepsy, we will treat with medications, as I did tell in the end. In fact, when we stimulate the brain with stem cells or cells, the epilepsy may increase. So that's why we do not consider stem cell as a treatment option for epilepsy. No. Down syndrome, yes, earlier the better always, but please take care of the medical part of the condition first. If a child has a cardiac issue, needs to be first taken care of. When the child is medically fit, then we look at the brain functioning. So yes, earlier you bring the Down's child, better the results, definitely. And someone wants to know about the cause of autism rising. No, I did not address this because of lack of time. I think we will need to have a separate talk only on autism, where I talk about all these other things. In short, we do not really know the actual cause of the rise of autism. There are a few theories, and some of the theories that we are working on. The most recent theory that we are working on is the folic acid metabolism. It correlates with the increase in autism. Folic acid fortification started in the United States in the 1990s to prevent neural tube defects. All mothers before conception and after conception were given a lot of folic acid to help the brain, form and connect. So food also started getting fortified. If you go to the super bazaar now and look at your oats or muesli, which are packed, they are full of vitamins. Unfortunately, these vitamins are inactive vitamins and may not be used by the body, which gets accumulated and becomes counterproductive. So as I mentioned in our research, 80% of children with autism appear to have a MTHFR gene mutation, which prevents the use of folic acid to be converted into methylfolate. These children, when they are in their mother's womb, are getting activated folate from the mother, and hence the initial part of the brain development appears to be fine. Once they are weaned off from the mother's milk and their body themselves have to form the methylfolate, is when the problem starts occurring. The body is unable to use the folate, which is important for neurotransmitter formation in the brain, such as serotonin and melatonin and dopamine, which is important for socialization, communication, and sleep. So this is one of our theories. That's why from 1990s to 2000, the autism is increasing. There are other possible factors that, for example, we are going from a joint family to a nuclear family setup. Autism is a social communication disorder. If you see in rural parts of our world, there may not be so much autism, but more in the urban. So also what we are eating, what we are breathing, so much contamination with heavy metals could also be one of the source. So autism is a multifactorial condition. So it is a combination of, things, or the way we are going towards Western lifestyle is also one of the possible reasons. All of these are adding to it. The use of 2G, 3G, 4G, 5G. This also the radioactive, the electromagnetic waves from our phone, from these towers, also in the initial part of the brain development may be affecting the brain also. So all of these, so lifestyle, we have to work on, yes, lifestyle. Very strongly recommend the use of methylfolate or folinic acid during pregnancy instead of plain folic acid. I think if we start with this, we might start seeing less of it. This is just our, theory from a lot of data that we are now looking at. But who's going to tell the OBGY? I don't know. Who's going to bell the cat? Can we conduct a thorough workup to determine source or triggers for seizures in epilepsy? We do not focus on epilepsy purely, but we can connect you to neurologist who's working with us, who can help you understand where the seizures develop. Usually an EEG should be able to give you that idea.
Okay. But, thank you for confirming my theory on 5G, 4G, 3G.
So we
And the
tell
towers
also
around
mothers.
us.
So the theory is that screen time is causing autism in the child, but we are going a little back and saying screen time in the mother is causing the autism. So if you keep the phone nearer to your womb, the electromagnetic waves are able to
Waves.
reach. So try to keep the phone away when you are pregnant. Use headphones better, and
Yeah.
try avoid screen time when you are pregnant. I think that is another suggestion.
Okay. Just two more questions. What are the results of the outcomes when you have stem cell treating multiple sclerosis?
Multiple sclerosis, when we started this work way back in 2008 and 9, multiple sclerosis was one of the conditions that we were treating. What we found initially was that this treatment was able to help to some extent reverse the neurodeficit, but because the condition itself is very unpredictable, there is exacerbation and remission. Even if there is an improvement, it doesn't sustain. So with time, what has happened is that those which have shown good results, our work has somehow gone in that direction. So we have lost multiple sclerosis as one of the indications quite a few years back. Actively, we do not treat because the results do not sustain.
All right. Wow. Okay. We need to. Hello?
Yes, I think there is one more question in the question answer. Can you offer ozone IV vitamin for someone or child with no neurological issues but would love to have the therapy? Okay, so we have another center. I did not have time, so I've not spoken about it. We have a sister's center just 10 minutes away from our hospital here, which is a KLS center for anti-aging and wellness. And we do treat non-neurological conditions there, not with cellular therapy, but with a combination of hyperbaric oxygen, ozone, and intravenous vitamins. This is more for adults. This is more for wellness and preventing of diseases. So we do treat, but not so much for children, but for adults. So the USP of this center is delay the inevitable and to prevent the preventable and delay the inevitable. So that's the so for such conditions,
Delay the
yes, you could reach
inevitable.
out to us, and we do treat. So you and me can go there and get treated, because everybody has some problem or the other, right? That your metabolism is up and down. Many people are gaining weight, not able to sleep. We had in fact a patient from Kenya who was insomniac. He had so many medications over the last 12 years, and just 1 week of treatment has helped him get off the medications and be able to sleep better. Depression has gone down. So yes, you could come to our wellness center. We would be happy to take care of that.
All right. Thank you, Dr. Nandini. I think we'll definitely have you back, because today's session was a bit rushed. and we'll definitely have you
Yes.
back for
Yeah,
the
before winding up,
individual topics.
yeah. So there is a, if you, do we have a time for the testimonial or not?
Oh, wow. I thought the videos were there.
No, no. So that's so
Yes, yes.
right now in the hospital, we have this patient from Nairobi who is the father is
Okay.
right here. So,
Yeah,
since I don't know, are they there still?
it's
I can see
fine.
Boniface, Joseph. Do you have Mr. Geoffrey?
Yeah, they're still in. They're still in.
I think Jeffrey, so Mr. Jeffrey's son has been treated with us 6 months back, and he's here for another treatment. I think he would be the right person to talk about his experience because this is the second time he's coming. So, if it's allowed, we can just request him to maybe in a few minutes just give his
Sure.
experience.
Over
Jeffrey,
to you,
could
Mr.
you
Body or
could you
Joffrey.
unmute yourself, Babazil?
Yes, I can. You cannot hear me?
Yes. Hello. Good
Hi.
evening.
Good evening. So my name is Geoffrey. I'm a product of Kenya. I'm a citizen of Kenya. So my child came here when he was, say, 310. That's 3 years and 10 months. That is last year. And when he came here, it's because, one, I met a friend of mine who brought his son here. And the son was 2 years, and in a period of 8 months, he would speak, and he did not need to bring him back because after the stem cell, then the kid was proper. So he advised me to go to one pediatrician who in Nairobi we believe in. He's called Mr. Wafula, and it's like he's the link to India. So when we went to Mr. Wafula, he told us to come to India. And long and short is that before we came, we
Hello. Has he? I
actions
think
with
he had.
kids, and he did not talk to others or even interact with his siblings. So we tried a lot of things, including earthing, including reducing sugars, including things that we were told are vitamins that would help him, but they did not bring what we wanted back home to a normality kind of, we can call it a normality session. So when it came to NeuroGen, we had the first stem cell, that was August last year. And after that, now in a period of the first 3 months, he was only hyper and we did not have a lot of changes. But in the next 3 or 4, now he has speech. He's able to tell you what he wants. He can call you, he can tell you bye. He can be able to study in a normal school. He goes to now a normal school, not a special school. And he's able even to do the toileting by himself. He can wipe himself. He can do a lot of things. So we decided we need to come back just to get him totally out of the spectrum. And from the results, he's 10 months back from where he should be today. And we are very proud because right now, even if we didn't come back, he would still make it. But now after this shot, now we believe he's as normal as he can be. And we are really proud of NeuroGen. The services here are good. We like the people treat you nicely, the staff are okay, and we really love the doctors because you can interact with them, ask questions as much as you want, and you'll still get feedback as fulfilling as you desire. They will give you a detailed results of what your child has been done. You get consents, and you've seen magic and miracles in your eyes as we go. So we are very proud of NeuroGen. We keep preaching it out there. I've brought a few of my friends here who have kids on the same autism and cerebral palsy, and they have given testimonials. We really interact with each other, and they say it's a blessing for us to have known NeuroGen. And thanks.
Thank
I'm
you so
still here
much.
for another 2 weeks. I'll be
Thank you
back
so
home by
much,
20.
Jeffrey. Thank you so much.
Thank you.
Thank you.
Okay,
Welcome.
I think that is quite encouraging, and yes, we are very proud of Azil also. Okay, Jimmy, over to you.
Yeah. All right. Thank you. So for Mr. Joffrey, thank you so much. And as we said, Dr. Nandini, please be available once we get opportunities to do such sessions. I think we'll go now topic by topic: autism, CP, ADHD, and the neuro-rehabilitation point, so that we can internalize the information better. With that, I'd like the audience to do a poll that you're sharing currently. Take some time and just fill it so that we gain feedback on the impact and relevance of these talks going forward, so that we can give you more and more. So take your time. There's just 2 questions so far, and we'll be appreciative for your participation. Is everyone able to vote? And click on the choices. All right, the next poll, as we wind up. All right, thank you guys. I can see the votes are moving. Thank you. All right. Thank you so much, Dr. Nandini, and thank you so much to NeuroGen for making time and being available for us. And we assure you, from our reach and our presence, we'll be able to funnel more patients for the miraculous outcomes.
Thank you so much, Jimmy, for this opportunity.
Yeah.
And hope to stay connected. And of course, let's take this awareness ahead. Awareness is the key.
All right.
For people to know that there is an option.
Yes, definitely.
Sorry.
I think awareness is lower in this area, and we'll work together to ensure that the awareness gets to our people. For Mr. Geoffrey, we'll be able to share with you a concept that will be shared through Sunita. All right. Thank you, guys. And
Thank you so much. Thank you very much. Thank you. Have a good day. Bye.
All right. Bye.